Hello, guys. Let's talk about endometriosis. You might have heard about this condition, but you might be wondering what it means. So, just to introduce myself, I'm Dr. Emmanuel. I'm a general practitioner in the United Kingdom, and I want to bring more light to this condition that affects so many young ladies. So, what is endometriosis? I'll start by saying that normally the inner part of the womb. So this is an image that represents what a womb or the uterus looks like. And this part that is painted pink is the muscle of the womb, which is called myometrium. This part that is painted red is actually the cavity, which is a potentially empty space that can house a baby. And that's called the uterine cavity. Now, between this space and the muscle is a very thin lining of tissue, which is called the endometrium. And it's that endometrium that usually bleeds when a woman has her periods. Endometriosis happens when tissues that resemble the endometrium are found outside of the uterus or outside of the womb. It can be found within the pelvic space, within the tummy. Sometimes on rare occasions, endometriosis tissues can be found elsewhere. There has been reports of endometriosis being found in tissues like the lungs, the brain, the liver. Now let's look further on endometriosis. As I said earlier, a lady typically would see her period monthly, and that period comes from the endometrium or the inner lining of your womb being shed. In endometriosis, those tissues which resemble the inner lining of the womb will also bleed or swell during the menstrual period. And that's why ladies that have endometriosis usually have excruciating pelvic pain or abdominal pain during their periods. And if it's someone who has endometrial tissue, endometriosis in their lungs, for instance, then during their periods, they might have some chest symptoms like chest pain, they might have cough, and they might even cough up blood. But as I said, that's actually rare to find people with endometriosis affecting the lungs. I know you'll be asking yourself, where then does endometriosis come from? How does that endometrial tissue find its way outside the womb? There are different theories. One is what is called a retrograde menstruation. And that means that it's been postulated that during the menstrual period, instead of the blood to flow downwards, so if I go to the slide back and explain, rather than the blood flowing downwards from the womb down into the vagina and out of the body, that blood might actually go backwards from the womb through the fallopian tubes and come out there and spill over into the womb, into the pelvic cavity. So that's the first theory. The second theory is what is called embryonic cell transformation. It's been postulated by this theory that when a lady gets to puberty, that some of the tissues in her organs, in her pelvic organs or some of the tissues elsewhere, the lining of the abdomen and pelvis called the peritoneum, that some of the cells there might actually transform into endometrial tissues to resemble the inner lining of the womb. Another theory is what is called the coelomic metaplasia. And this theory explains that sometimes over a person's life, usually when they're young, that some of the tissues in their tummy or elsewhere might just undergo changes and end up being transformed into tissues that resemble the inner lining of the womb. Another theory is that there could be actual spread from the inner lining of the womb, through the blood and through the lymphatic and vascular systems to other parts of the body. And that theory actually tries to explain why, in rare occasions, some people might actually have these endometriosis tissues in their lungs or brain or other organs that are actually far away from the womb. Another theory is surgical implantation, that when a person has had an operation on their womb, maybe an operation to remove fibroids or a cesarean section, that there might actually be some endometrial tissues that might be, spilled into the pelvis or into the abdominal cavity, or even, left on the wound, such that sometimes endometriosis can actually happen on cesarean section scars. As you can see in this photo, this is a lady who appears to be in painful distress, gripping her tummy in pain. Endometriosis typically will cause a lot of pain because just as the inner lining of the womb swells before the periods and then sheds and bleeds and sheds and bleeds, the endometriosis tissue that is in the pelvis or abdomen or elsewhere would also swell and could also bleed around that area where it's found. And that will usually cause pain and usually causes a lot of pain. Pain that might be so bad that the lady might actually have to stay off work or off school. If a person thinks or suspects they might be having endometriosis, if they're having painful periods, they usually will advise that they speak with a doctor. And what your doctor will typically do is your doctor will take a history from you, have that discussion with you, get all the information on how your menstrual periods and your menstrual cycle, whether it's painful, when exactly the pain happens, how severe the pain is, ask you all the relevant questions, your lifestyle, whether you smoke, whether you drink, whether you exercise, how it's affecting you, affecting your life. The next thing is your doctor would then try to understand what could be causing this pain or these painful periods. And that will take us to what else can actually cause painful periods. I will start with the one at the bottom, which is called primary dysmenorrhea. Primary dysmenorrhea means there's actually no found cause to why a lady will be having painful periods. There's some people who experience painful periods, and after all the investigations, after all the scans, and even after doing what we call laparoscopy or a keyhole surgery, nothing will be found to explain why they have painful periods. In such a situation, usually it's been said that it's just changes, it's due to changes in hormones and what we call cytokines. Cytokines are chemicals that mediate inflammation. So it could be related to inflammatory cytokines or hormonal changes. Another cause of painful period is uterine fibroids. So if we look at if you go back to the photo of the womb, uterine fibroids happen when there is an enlargement, when there are lumps within the muscle of the womb, and those lumps are usually not cancerous. So they're usually what we call benign or harmless lumps growing within the muscle of the womb, and they can cause heavy periods as well as painful periods. Another known cause of painful periods is what is called adenomyosis. Adenomyosis is simply endometriosis that is found within the muscle of the womb. So it also will swell and cause lots of pain, and usually will cause painful periods. How then is endometriosis treated? Previously, in the olden days, and still currently being done in some countries, open surgery could be used, which is called laparotomy, where an opening, a large opening is made into the tummy, and the endometriosis tissue is found and removed. But more recently, a keyhole surgery, which is far less invasive because it's unusually has smaller scars and quicker recovery time from surgery and anesthesia. So laparoscopy or keyhole surgery is usually used to confirm the diagnosis of endometriosis, because from what you can see, the surgeon uses these instruments, and you can see the screen. While looking at the screen, he or she can see what's going on within the tummy cavity, and that's the womb. You can see the womb there, and they can find those endometriosis tissues that are on the womb or outside the womb or even in the abdominal cavity, and then they can remove them. if it's safe to do. Sometimes endometriosis could even be found on the bowels, and sometimes the surgeon might have to decide if it's safe to remove the bowels. Sometimes they might have to remove a portion of the bowel if the endometriosis is difficult to remove. I want to say thank you for watching and listening to this point. If you have any comments or questions, kindly leave them on the comment section. If you haven't yet subscribed to my channel, please do. Please like this video because it communicates to the algorithm or the YouTube code that this video has been helpful, and then this video will be recommended so it pops up on the screen of other YouTube users. I'll see you in the next one. Thank you very much.